Hi, Mr. Jain. How are you?
Yeah, I'm all well. How are you, sir?
I am all right. A surprise call this morning I didn't expect.
Okay.
So I'm excited to talk to you and tell you what I'm doing, and you can ask me questions. I think I've sent all the information you need.
We understand both the tech part, the startup ecosystem part, the clinical immersion part, and the business part of the ecosystem.
Okay, that's fine. That's interesting because usually computer people come to me, and this is the first time I'm coming across doctors directly, one to one.
Yeah.
It all started in 1983. I qualified as a doctor in Bangalore Medical College, went to UK, but with a vision. You see, I lived in a village, and people used to come to my village thinking it is a doctor's farm. I was a medical student, and these poor people didn't have money. And what can I do? I'm doing anatomy, physiology, biochemistry. But I used to advise them and help them. But that one culminated into a crisis when I graduated. Because when I graduated, we were still sterilizing syringes and needles using autoclave thingy. My friends started doing urine tests, dipsticks, X-rays. These were all new innovations which came up. So instead of charging them 100 rupees for a consultation, they were getting 300 rupees. They were buying new cars very fast, giving 1 cc of Navalcin, 1 cc of Rastaclin. Yeah? So I was really annoyed. This profession is not to make money. According to me, I don't know about other people, okay? I'm telling you on what I think. So I wanted to develop a system where I can help people to differentiate between serious problem and not serious problem. So if it is a serious problem, they have to go to the doctor. If it's not serious, like getting a fungal infection on the toenail or something silly like a wart, or you see people go to a doctor and they are unnecessarily spending money which they don't have to. So I had this vision that we must bifurcate into serious, not serious, only serious goes to the doctor. So I went to England, and as soon as I became a registrar, I started monitoring the junior doctors. It's not like here in UK. I worked in 40 years in UK. Okay? So I was the supervisor. Basically, I am the doctor in-house. My consultant would be playing golf, but I am the one who's doing everything. Okay? So I had 7 HSs to deal with, not one. Because in pediatrics, we have neonatal ward, intensive care, special care, respite care. So there are 7
So here in India, we call them as resident doctors.
Yeah, that's what he said. Even Americans call them residents. But they are my junior doctors who are SHOs, qualified, done 1 year of internship, and then they come to pediatrics. So they are already 1 year experienced as a clinician. When they come there, they are completely blank because they have never dealt with children. So every child comes in, they used to call me, Dr. Sri, can you come and have a look at this child? I can't examine. So in other words, I was running like a yo-yo from one place to the other. So I created a first program called PAT, Pediatric Assessment Tool. It was created in 1984-85. This one, I classified it. I in fact wrote an algorithms. That time I called it the flow chart. Fever. I didn't care about the fever. I only concentrated on the subclasses. So I combined that so that the doctors would touch that. It was a touch screen. And then when I touch it, it dropped menu. High fever, mild fever, moderate fever, shields and rigors. So they could choose it, and in the end it said, call Sri, don't call Sri. Send the child home. So the number of admissions dropped, and I slept and got paid because the SHOs were not calling me in the middle of the night for silly things. So I did that, but that one I was about to validate, and I stumbled across a 14-year-old boy coming with MRSA. At that time, it was not known as MRSA. It was called normal commensals. That boy died within 8 hours. The parents were abusive. They were racist because they said, I'm not giving the antibiotic, though I was giving. And it was a weekend, so I had to contact infectious disease controller in tropical disease in Austria. Because in UK, I can contact many doctors from all over the world. So I spoke to people, and we didn't have an antibiotic. The boy died. That physical and verbal abuse frightened me. I said, today it has happened to me, tomorrow it will happen to every other doctor in the world. Because if the patients are upset, they will attack you. They will beat you up because they think you are not doing the treatment right. So I started thinking about it. First, I wanted to find out what are the infections. I did a lot of work associated that with IV cannulas and endotracheal tube intubation. When the ET tube keeps falling down, the doctors don't take care, they put it in, child develops pneumonia and dies. So it was all related to bacterial infections. Until 1999, I was sick and tired of seeing children dying, not because of my problem, it was because the nurses and doctors were not doing things right. I tried to warn health authorities that this is happening, MRSA is spreading in UK like mad, it is all happening because we are not doing the treatment right. But they didn't care. Then 1999, I retrained myself to be a family physician. In other words, I had to go through 1 year of residency and I became a GP, a family physician. There I started reading notes of other doctors. You understand, when I go to work as a locum, I get the chance to read other doctors' notes. So the doctor's notes I've read, the patient comes in. I'm the second doctor they're coming to. I know that the patient was treated with an antibiotic because he had pneumonia, according to the notes. But when the patient comes there, he tells me a totally different story. I started seeing this pattern everywhere in UK. Good clinics, not good clinics, poor clinics, MOD, private clinics. All the doctors are writing notes in the notes which is not 100% honest. They have never examined a patient. So many cases. People had cytosine influences. Nobody has auscultated. 21 doctors have examined this patient but failed to find out where the heartbeat is. So I realized that actually doctors are writing notes to protect themselves where the patient is getting wrong. So I collected the primary first complaint they give, headache, fever, sore throat. I wrote it down, compiled the whole list and created Maya, a list of symptoms with color codes. So instead of using names, you can say, oh, what do I have? Sore throat. You can look it until sore throat is infection, blue. So it's infection. So they know it is infection. So they should not sit with other people. So in other words, I used 3 color combinations, 4 color combinations, 2 color combinations, and I found 3 color combinations traps more than 70 to 80% of all serious and non-serious. 2 symptoms do so provided there is no fever. So nearly 80% of patients who come first consultation, I can say whether they need to see a doctor or not. Am I clear? Have you understood my reason?
Yes.
This one, I wrote a book in 2050. I came to India, sat with the computer programmers for 1 year and developed an app called Dr. Maya. And this was available in Google and app stores. Nobody looked at it because everybody thinks symptom checker. Symptom checker, I am the pioneer. You can ask ChatGPT any question about me, it will tell you who I am. I created the first digitalization of medical thing. In 1919, Google didn't exist, AOL didn't exist, none of them were there. I created the first patient-centered digitalization. At that time, there was they can't send messages like now. At that time, they had to send me emails. I was not commercializing this because my intention is not money. My intention is to systemize the healthcare. So what happened was I was getting too many emails. And at the same time, I realized sharing too much information to patient is not good because it inflicts fear. They get scared when they look at cancer in the last list. There is cancer, every symptom is associated with cancer. They don't read everything, they read only cancer. And they get frightened, they get anxious. So that is not our intention. Our intention is to make them understand serious or not. Come to us, we will examine and tell you whether you have cancer or not. But if you give it to them in the first, they think they have cancer. Some of them will come, some of them won't come. So this app is actually something which will help people to understand when they should consult a doctor. So I wrote a book in last year, end of last year. I'm in India right now. So I wrote a book called Art of Self-Diagnosis. This is to educate people how to use my color-coded system to differentiate, and gave it to ChatGPT to review. ChatGPT read that and adopted my system, saying it is groundbreaking, revolutionary, because it can recognize pattern. It does not follow algorithms. All other AI uses algorithms. In other words, you have to say, if you have sore throat, take penicillin. If you have this, you do that. This is what the doctors will write. But computer can't think based on that. It just follows the instruction. It doesn't think like me. Because I've given the color coding, ChatGPT thinks like me. And I don't give any information about any disease. It bifurcates, it classifies, just like you say, chills and rigors, burning sensation of urine, and the third symptom is passing too many increased frequency in urine. We know it is urinary tract infection. So immediately it diagnoses it as UTI, and then it brings the information of that. So in other words, instead of asking one symptom at a time, fever, what kind of fever, yes, no, yes, no, yes, no, that is how the algorithm goes. I mean, who the hell can answer 20 questions when they are ill? They will be having headache, they are dying, and they are asking yes, no, yes, no. So all these algorithms, artificial intelligence will not work in this system. Mine does not ask any yes or no. You just speak to it in any language, Hindi, Tamil.
Actually, your device is there for demo.
Mine is already there. ChatGPT it's called Dr. Maya GPT. Okay? Only thing I need now is an app so that you can monetize it. I want it to monetize because I want money for my charity.
Correct.
You want money because you want to be rich, yeah? But I want the system to come to India because this will become the hub. Your medical college will become the hub because I am going to move from Bangalore, come and sit with you because I am not going to be sitting in Bangalore doing all this. So if you say you will support me, I am not asking for any funds, but you might have to put funds to create the app because I will instruct you how to do it because I have thought about it for 40 years. And there is no loophole. All that we need is in 2 weeks, we can make an app. You can go and give it to Modi. I will take it to London, UK, USA, all over the world, Suriname, presidents, everywhere. We will implement it there as well. But you will be the first person as the hub. In other words, it will challenge CDC, WHO, because if in your flats, there are 700 flats, one person gets infected, everybody will get infected. Now, how would you know? Maya will know because 10 people are coming from the same address. We program it in such a way, if there are more than 10 people, please alert us. Immediately we cordon off, isolate, so that the people will not walk through. So there are 4 colors. Yellow color is go to the chemist, do what you want. Green, speak to a triage nurse. So you have a triage system where they speak. Speak to a doctor. The phone call from London will come to your college. Why? Because I'm putting your doctor's name there. So you will take the call, just triage them. If they have to go to operations, they go to operations. You can link up hospitals anywhere in the world. You can also divert the patient to your hospital. Whatever it is, I don't care how you're going to systemize that so that you are going to monetize it. I want every doctor to sit at home and make money. Let all the doctors in the world keep working. You understand? We can get easy $10. NHS 111 came after I did all this because I have a domain name called 111.com. Okay? It's easy to remember. So they get 80 million calls a year. They just use nurses to give advice. How the hell can a nurse advise emergency treatment? You tell me. Junior doctors are making mistakes. So many people are dying. So I challenged the Secretary of the State. I said this is unethical medicine because it is quackery. A nurse or anybody is not qualified and trained. So an Indian doctor goes to England now, he is working under a nurse who sat behind me for 14 days. And she works like a doctor in UK. Would you like to do that? 100 people killed themselves. because the nurses will not allow you to do what you want to do. So they are losing their freedom. So I am bent on getting collaboration with universities, healthcare, and present it as a team, because I am alone. I don't have family, I don't have friends, I don't have anything. I'm sitting here in my room in front of the computer making videos. Okay? So if you say yes, then let's discuss how we proceed. I'm not wasting my time. I applied to you long time ago, I almost forgot about it. So I am in this situation. You can ask me any questions.
Okay. So thank you very much for talking to us in very detail of your expertise, experience, motivation, and your desire to serve the community, and that you want others to monetize over your experience, which you have written in the book, The Art of Self-Diagnosis. So is the book available in the market for people?
Yeah, you can get it in Amazon.
Okay. Secondly, I'm very happy that you applied for this program, and apologies that we started this a little late. So this particular medical college is country's first incubation center in a public hospital, a very new concept, and we are also a Stanford center, Stanford by design center in the government hospital.
Okay.
And we are making up an ecosystem around doctors in the country. First of its kind of experiment, and we're just trying to give platforms to clinicians where they want devices with their own expertise into it.
Yeah.
Normally what happens is we get devices in the system, and then we are asked to get used to the device.
Okay.
Here what we're trying to create is we're trying to co-create with the doctors. Listen to the problem statements of our own hospital or of the community of the doctors facing, and then we try to get the startups and to work on those problem statements so that we can actually have devices which are affordable, devices which are doctors, and devices which have come out of the doctor's own problem statement.
Okay,
Right.
let me chip in here. Okay, I have 6 devices. The one device which I'm working right now is an IV cannula. It's a self-introducing cannula. I have world patent on it, and I've updated recently. I discussed with Karnataka government. They are interested because they can save 3,300 crores a year. Because IV cannulas, you discard more cannulas than you use them. So my cannula is very safe. It was already published in Anesthesia and Analgesia in 1991, and doctors from all over the world wanted it because it's a self-introducing cannula. In other words, I put a spring inside, and it works very well because I've done a trial as well, and I've also published the results, which all the anesthetists from all over the world wanted it. When Ebola came in, doctors from there contacted me because they had problem cannulating Ebola patients sitting with this gown and mask, because it takes more than 20 minutes to put an IV on a dehydrated patient. Mine goes 94% first shot. So they wanted to see where they can get my cannula, and I couldn't. The problem I had was to get the tool makers to make the tool for it. My products were exhibited in Medica. Have you heard of Medica in Germany? The UK government identified that as an innovation of the year, and they gave me a stand to exhibit my product. Thousands and thousands of people came to see that because I had written an article in their magazine about IV cannula. The reason I did it is because first time they will clean it properly, second time they forget it, they introduce infections very often, intravenous, and the children get septic and they die. Nobody talks about that. You cannot say that I introduced it. They say I washed my hands. So I've done a lot of work on all that. So now if this next pandemic which is going to come is skin-related infection. Okay? I am telling you now, 2016 I predicted SARS. I wrote about it called Superbug Pandemic in medical journal, and nobody cared. 2 years later you saw COVID. Now I'm telling you in the next 2 to 3 years you're going to get a skin infection which will spread like wildfire. It's going to be 20 to 30 times worse than COVID. In other words, you cannot clean the bed sheets in your hospital. You cannot clean the furnitures. You cannot clean the stethoscopes. How the hell can you work in a situation when there is no antibiotic? Everybody will die with ARM, nothing else. And the worst thing is fungus has come in. There is called Candida auris, which spread in 24 hours, 40 hospitals in New York. And they could not clean anything. And they cleaned it. What did they do? They killed all the bacteria. Because antiseptics and all these chemicals kill bacteria, not the fungus. The fungus multiplied like mad. So, Candida auris is one of the most scariest infection I'm thinking of because it's spread by spores. So, we doctors are first in the line to get infected. It is your life I'm talking about. Forget about the people, I'm not interested. If he gets infected, he's going to die, let him die at home. I'm not interested. I am interested in you because my Hippocrates quote says, protect your brothers and sisters. So you have to think now. You go to the hospital as if nothing has happened, get one infected, go home, your daughter or children gets infected from your skin or your shirt because you're not going to be taking shower after seeing every patient, are you? They come and they sit like this and put all the fungus on your table. We are in trouble. So we need a system to identify them before they come into the hospital. So Maya will do that because you will know that the patient is booking an appointment. He has infection. So you block him. You say, please go to the isolation hospital. Or let the public health fellows deal with it. We are not going to be lifesavers. We will share our knowledge and experience to tell them. We are not God to save lives. So let us be practical and find a solution to protect ourselves and empower patients so that they will deal with the common symptoms themselves. I am not asking affluent thing, it is just common sense. You understand?
I got it.
So I have devices. If you are interested, you can go to Venaican. I named it after my guru, Venaican. Venaican. So instead of saying when flown, I say Venaican. And that is a self-introducing cannula. There's a website. You can see how it works. And in my personal profile, there is a video as well which you can watch. I'm cannulating a baby less than 700 grams. And that baby doesn't even cry. It is yawning and sleeping because it goes smoothly inside, no fiddling around.
Okay.
So if you have boys who want to start up a company with devices, I am the man for you.
We as doctors and as per the policy, we cannot start our own company.
No, not you, but if there are other people who are
we
doing.
We are here to help the ecosystem. So this looks like a very, very great idea. We will get into the document that you have said and shared.
Yeah.
And then probably expecting to meet you soon with your experience. We'll try to definitely get the application ready. We have our own resources here.
Mm-hmm.
But all you will come down to Delhi and to be part of our system.
Yeah, I will.
Yeah. Okay. So
So
we will get in touch with you, sir.
I didn't know you were based in
that
this.
we're doing for all the other startups.
Yeah.
So that is how good that we interacted with you. And normally startups at TRL level 7, 8, 9, they come down to us for validation, trial, efficacy. Because we're trying to make a doctors-driven ecosystem here at the public hospital, which you rarely see anywhere in the country.
Yes. Mine is almost complete. All that I need is people like you to take it forward. Because I am retired, I don't have any contact, I'm isolated, I'm not rich.
The passion which you carry is the most important thing to develop.
Absolutely. Because this is going to be a legacy. It will stay after I die. My children are going to be using my system.
We will get back to you as so
No,
it will be just few days that we'll get in touch with you again, and we'll try to discuss.
My question
create things together. Yeah.
Yeah, Dinesh. Yeah, tell me.
Yes, sir. Yes, sir. Good afternoon. So my question is, what you are doing for Canada, or is suppose you have predicted that there will be a next pandemic in coming times. So what you are planning, or what your vision for that?
Candida auris.
Yes.
Candida albicans has been common, yeah? Candida auris
correct.
cannot be treated with any drug.
Correct.
So the problem is only prevention
Okay.
and protection. So how will you prevent it? It infects immunodepressed patients. It infects women. So how do you prevent them? So I have done a little bit of study in medicinal plants in Auroville for 4 months. I've written a book called Nature's Pharmacy. I've developed a concoction which is similar to cranberry juice. Because cranberry juice is not available here, we can use some of the fruits and make a juice which can be sold. It makes the urine alkaline so that the women will not get infected. It's a preventer. So you have a liquid which they drink every day. Somebody can make money. I will also make money for my charity. I am using my charity. See, I have only one daughter. I don't have a house. I don't have anything. I live out of a suitcase. I am dedicated to my work. This work has to stay. So my money is going to be put into a fund called Dr. Maya Foundation, which will protect doctors like you. You die, your wife and nobody gets pension. I discussed about this. Who the hell is going to support the family of doctors who die with COVID? Nobody. 1 year pension they'll give, I believe, salary. That's it. But after that, what is your wife and children going to do? Maya Foundation will take care of that. We will use our power to get training. We will get money to fund them. We will educate the children. So Maya Foundation is going to take care of doctors. And if you challenge the medical profession, they will harass you. I put up with harassment for 14 years. Nobody came to my help. Even doctors were scared. I lost my money. I lost my family. I lost everything. But I didn't care. I said, I am standing in for a principle. Our duty is to protect humanity, and I will do it at any cost. I don't care living in Bombay begging on the street, but I will not allow these crooks to just take over our profession for a ride. They are taking us for a ride by threatening you. I will take them off, and that is my mission. You got it? So
yes.
Do not, I have methods for Candida auris, I have methods for Staphylococcus, how to do everything, because I have got nothing else to do. It's like going to the Himalayas and meditating. I'm meditating here.
Not an offer, we are very junior to you. I have a very interesting request. With your expertise and with the dream which we are building here at the government hospital. Why don't you join as one of the mentors here?
I will. If you just give me a job and say, okay, I'll give you a room to stay, food I need traveling expenses, daily expense. Not a lot. I get pension anyway. That is more than enough for me to live. But you have to find me a place nearby where I can stay comfortably. I don't need a big, high-fluent, big houses. I'm living here in 2-room bedroom house, paying 15,000 rupees. So some decent place to stay and a team of fellows who are passionate, interested, doing something worthwhile. Not for degree, not for jobs. We have to do it from India. Enough is enough. If I do the same work in UK, I have plenty of contacts. They wanted to start an industry here.
And yes, sir.
Okay?
Yes, sir.
So, but unfortunately, they couldn't find the right tool. They found somebody in Gujarat who had some eye problem or something. And they just diverted, okay? But this product, now in America, I've been contacted by 2 companies. All that I have to say is yes. They will make the tooling. It costs about 20,000-30,000 rupees. We make samples, give it to you, you do it in your hospital, do the test, and then you have a product. Before you bring the product out, Johnson will run after you because they know my product is going to de-skill doctors. That's why they didn't do it. I have letters also. Okay? I will share it with you with no problem. I have documents to prove my work is 100%.
Okay. Sir, you have sent the documents of Venaican to Dr. Rahul. You have already sent it, na?
Yeah. I don't remember what I sent. But my personal profile thingy, which I sent you the scan it, you can go down and see how the designs, because I did some 3D designs, models and all that. Yeah.
Yes, sir.
It works very well. Okay.
Yes, sir.
But it has to be done in tooling, proper tooling. They are doing some temporary, those work doesn't. We need to manufacture 3 sizes or 1 size at least.
Okay.
About 1,000. And give it to patients. Compare the conventional method with my method. And
Correct.
You will have a record to publish it. And I am the inventor. There is nobody who can copy it. My patent is so perfect. Nobody has come out with a self-introducing cannula even today, even though my patent was in 1991.
Yes, sir.
Because they can't crack it.
Okay, sir. We will get back to you. As of it now, it's very promising, very, very promising, sir.
It's a great honor to meet you too. Okay, I
Yes,
have
sir.
been desperately searching. Unfortunately, all my friends who were all in high position have died during COVID. So I'm left alone right now. But I haven't lost my focus, and I am
Yes.
going to achieve it. And
Okay.
I hope it is
We
India.
will be the vehicle for you to achieve your desire.
That's it. I want a team. I want a family. I want friends. I'm isolated. I don't want to stay here longer. I was thinking of going to Indonesia because somebody invited me there. But if I go there, that's the end of Indian story. But if I do it in India, I'll be the proudest man on earth.
We will do it, sir. We will do it together. That's a promise.
Yeah, please do not hesitate to ask me any questions. If you want, I'll
No.
send you the link to my ChatGPT. So what you do is,
Sir,
you just press the speaker, ask about
at this
me.
presentation, let me tell you, at this presentation, anybody who is a doctor who is pitching, we are not evaluating them.
Why did you choose
Any
me
doctor
then?
with any idea, we are just getting them onto the table.
So why did you choose me then? I'm a doctor.
I was not knowing that you're a doctor. I did not go through your profile. I said my team is managing all the meetings. I am just counting the numbers that I have to speak to people, right?
Yeah.
So while in the discussion only, I get to know whether they are doctors or not.
Okay.
I was not, I was
But
not-
anyway, it's an honor because you can understand what I'm talking about. Not many people can. Common person thinks I'm crazy, but they don't know what happens behind the screen. So, I've sent you all the people
Sir,
in the email.
Just allow me 2-3 days of time.
Okay.
I will myself get back to you.
Okay.
My team
You
will
have to
do
make
all
it
the
fast.
possible things faster than traveling to Bangalore.
Yeah. No, I can come along. You don't have to come. I can come and meet your team. So,
Perfect.
say any
So let us
PhD
get
student.
back to you again.
Yeah.
Yeah. Thank you. Thank you so much for today and for sharing all your expertise and experience. Thank you so much.
Brilliant.
Thank you so much.
Thank you.
Thank you.
Bye.
Thank you.
Bye. Take care.